3 North Carolina colleges are transitioning to online learning after several outbreaks on their campuses. But could ELN be next? Our Baylor Rodman spoke with North Carolina's State Health Director and Chief Medical Officer Elizabeth Cuervo-Tilson to get her thoughts on the handling of coronavirus by higher education institutions in the state. Take a look.
Residential campuses throughout the state be holding in-person instruction?
I think that question, that's one of the biggest questions, one of the hardest decisions, and there's an enormous amount of risk and benefit. So I don't know that there's a clear answer. I think we have to think about those risks and benefits and think about all the strategies we can put into place to reduce risk. We're never going to get to no risk. We know there's virus in the community, but how can we decrease risk as much as possible? And what are the resources of the different campuses and the different universities to do that? On our website, we have very detailed guidance, and we have shared it with all of our institutes of higher education, worked with the leadership of our Institute of Higher Education, of all the strategies they can put into place to decrease risks.
How would you suggest that people can stay social, not just be in a room talking to their wall, driving themselves crazy, but also being safe at the same time?
Yeah, and we say social distancing, but really what we should be saying is physically distancing, but still wanting to stay socially connected. So humans are very social creatures. We need to stay socially connected. And I do see this as kind of a other side effect of this pandemic. Yes, it's a respiratory virus and it causes respiratory problems, but the other pieces that it's causing, I think, is anxiety, depression, the mental health piece of it, because it is separating us socially, and that is an incredibly important piece of our wiring.
You're concerned about the strain of university students on residential campuses being all put on the healthcare system and then overwhelming that?
Yeah, I think, and that's a really, really important piece, I think, for our students to remember, that you are not in isolation, you are not in a bubble, right? What happens on college campuses affects the community, not just the community on those college campuses, but the communities in which those college campuses are.
What do you think it means for North Carolinians to be able to play an active role in containing the pandemic?
I think the most important thing everybody can do is what we say, those 3 W's, practice the 3 W's. It seems very simple, but it's the most powerful tool that we have, and effective. So wearing that face covering, waiting 6 feet apart, washing your hands, and then I'm going to add one, avoiding large gatherings of people. If we all do that, then we really have the power to change the trajectory of this virus. And we saw that, right? When we all started wearing a face covering, we saw that change in our cases over the summer. That was amazing. We saw that. Now we're going to have to do it with even more vigor. Now that we have more people together on campuses, we all are going to have to follow those 3 W's. And then again, the addition in not social gatherings.
Tilson also says some of the lessons learned so far is that none of us can be complacent. COVID-19 has spread quickly, and it's been important to her and other state officials to get out in front of it.